Hello y buenos días. My name is Domingo Garcia and I'm the National President of LULAC. And we are here to respond to several issues as we see this coronavirus spread throughout the United States and Puerto Rico. Let me and assure everybody that we are here at LULAC in Washington, here in Dallas, and throughout the country, and even LULAC Council are here to make sure that we help and make sure that the impact of this virus, both from a health position and an economic position, is lessened. So I'm going to talk about health. Number one, it's important that anybody that has a flu symptom or any type of issues regarding the health, seek care and go to their nearest health provider, hospital, and get that checked out, and self-quarantine if they need to be. The fact of the matter is, even if you're undocumented, even if you're a permanent legal resident, the U.S. government has just said that the public charge rule will not apply if you get a coronavirus test. And we need to make sure that if you get both immediate emergency care or preventive care, again, that will not hurt you in your future application for citizenship or for legal status in this country. So it's important that we know that's reassured to our community. Second, it's important that everybody knows that any coronavirus test will be free to anybody in America and in Puerto Rico. So don't worry about whether do you have enough money to pay for this coronavirus test because you're having shortness of breath, you have a sore throat, you have any symptoms that you might believe are the flu or that might be indicative of the coronavirus. Again, seek that medical attention, seek that medical care, and quarantine yourself. And don't worry about the cost of getting that test done. There has been millions of dollars that have been allocated, actually billions of dollars have been allocated to make sure that anybody who needs a test is tested at no cost. We at LULAC are going to make sure that continues. And second, that any treatment be provided to any person, U.S. citizen, resident, or immigrant, to make sure that they get the attention they need and that the virus does not spread and impact other people. Second, we're also concerned to make sure that the virus doesn't spread in the detention centers that are holding immigrants throughout the United States. These are potential death traps. If the virus goes into a detention center and if there is limited to no health care, that can spread to the guards who take it home, to the staff at the detention centers who take it home, and the virus can continue expanding. We believe that all immigrants that are currently in detention centers that are nonviolent should be immediately released on a bond with a court date given until the coronavirus emergency is over. Failure to do so, I think, could exacerbate the problem and create millions, potentially hundreds of thousands of people who will be infected in these centers, as well as the staff and the workers at these centers. And there will not be enough adequate medical care to take care of these people, and that could result in many unnecessary deaths. And so that needs to be done, as well as the prison systems. The jails and prisons, misdemeanors, people held for misdemeanors, people held on nonviolent offenses need to be looked at terms of being either furloughed early or given bonds and released until this emergency is over. Keeping them in crowded centers and prisons with little ventilation, again, could just exacerbate this coronavirus and add thousands and thousands of more people and millions of more dollars in healthcare for these populations. Third, many of the people that are delivering the groceries, when people are worried about toilet paper and worried about hand sanitizers, okay, not being enough, we need to make sure that we have and take care of those communities. The fact of the matter is that stalker at that HEB, at that Kroger, or that Albertsons, or that Publix is probably a Latino or Latina. The truck driver is probably a Latino or Latina. The people who picked the crops and brought those vegetables to you, Latino or Latina. And they are an important part of the supply chain. And we need to make sure that those workers are taken care of. And if they are sick, that they're sick pay, whether they're a farm worker, whether they're a trucker, or whether they're a person at a grocery store, that if they get sick, they get sick pay and they get paid for their time off if they have to quarantine for 14 days, and that they be provided adequate sanitary and health, whether that's sanitational masks, whether that is influenza shots, to make sure that they're able to continue bringing food and supplies to our grocery stores and continue to feed America. Those populations need to be protected both through healthcare and through economic support in case they are having any issues or problems with their own health. Third, everybody in the entertainment industry. We know, as a former waiter myself, as a former bartender, I know that I depended on tips and the minimum wages that we got. And now that restaurants and bars and hotels and gyms and nail parlors are being closed, There are large sections of the population, Latino, but everybody that could be impacted. They need to make sure that they have adequate financial resources to help them during this crisis. That's why LULAC is asking that the U.S. government consider giving every American $1,000 a month until the health crisis is over. Failure to do so will leave large numbers, millions of people that are in the service industries at the mercy of probably not being able to pay their rent, not being able to pay their mortgage, not being able to pay their car payments or credit cards. And that will have a large ripple effect on the economy. So the U.S. government, you bailed out Wall Street, you bailed out big big banks and insurance companies. You can help Jose and Maria. You can help Mary and John. You can help Leroy and Beyonce. Anybody who needs that help, you can do that. So again, let's concentrate on the people and not just bail out the 1%, but let's bail out Main Street, not just Wall Street. Finally, it's important that we come together as a LULAC Familia and as an American family and help each other out in this time of need. That means if you have a senior who is maybe the abuelita, the abuelito, el tío, tía, they might be shut in, help them and bring them their groceries. Help them and go to the pharmacy and bring them their medications. Let's all work together to make sure that the number of deaths is minimized and that we as Americans continue to be strong and unite and make sure that we overcome this health crisis and come out with the minimal damage as possible, both economically as well as health-wise. Looking forward to working with you, and LULAC is doing everything we can to assist in that area. Go to lulac.org if you want to get more information on what LULAC is doing, and keep in touch with us via this LULAC YouTube channel. Thank you. Que Dios los bendiga.